There are usually two types of ulcers that we find in our body. One is the gastric ulcers and the other is the duodenal ulcers. They're known as peptic ulcers. Now, ulcers found in the stomach are called gastric ulcers. Ulcers found in the rest of the intestines, especially the duodenum, is called a duodenal ulcer. The difference between the two are very stark. Now, one, the patient gets pain immediately after eating, and that because eating is so painful, they avoid eating. And the other one, the pain comes around an hour or 2 hours after eating. And that's why the patient feels better while eating. And that's why they keep eating. Now, when a patient comes to us with acidity, as a homeopath, it is my job to see whether they have a gastric ulcer or a duodenal ulcer. And the best way to see it is whether the patient is fat or the patient is thin. Now, if the patient is fat, that means there's a high chance of them having a duodenal ulcer because they prefer eating, which helps them relieve the pain, and that's how the ulcer goes away. And if it's a gastric ulcer, then they're usually thin, skinny, and they don't want to eat because eating is painful for them. Now, in homeopathy, we have different medicines for pain immediately after eating and pain which is better by eating. And that's how you must look at the homeopathic medicines. Now, homeopathic medicines like Robinia, Carb, Graphites, Abies Nigra, where the patient is obese, think of duodenal ulcers. And when you see thin patients with gastric complaints, then you think of like Nux Vomica, Arsenic, think of gastric ulcers.